Deputy President David Mabuza, who is also the chairperson of the South African National AIDS Council, will today deliver the keynote address at the World TB Day commemoration at Mbombela in Mpumalanga. This year's theme is "The Clock is Ticking," which conveys the sense that the world is running out of time to act on global leaders' commitments to end TB. To discuss this, we're joined by Sindi Shangase, the Executive Director for Positive Women's Network. Very good morning to you, Ms. Shangase. Are people still screening for TB, considering that currently the focus has shifted to COVID-19?
Good morning, Devi and the viewers. Yes, the clock is ticking. Let's find, treat, and end TB. But we also need to ground TB treatment responses in human rights, and the answer is yes, people are screening for TB, but we are seeing that healthcare facilities are burdened with COVID cases as a priority. As a result, the healthcare facilities are unable to find link people living with TB to treatment and care.
I don't know if you're still there, Sindi. Can you hear us?
Yes, I can hear you.
Sindi, just how much of a barrier is funding in the fight against TB?
Funding is a big barrier in funding TB. You would know that in order to manage TB as a country and be able to treat TB, we need to be able to buy drugs to treat TB. And we know that since the 1990s, the HIV coincided with TB, which accelerated extrapulmonary TB, like TB meningitis, TB of the heart, and TB of the stomach or the abdominal, which means we had to find more innovative ways to treat TB and reduce drug-resistant TB. So all of that work requires research, which needs funding, and the healthcare system requires funding to purchase the drugs, and communities need to be funded as well to find patients who are lost to follow up, link them to care, and provide psychosocial support to ensure retention in care. And in addition, other government departments like social development also need to provide support to people living with HIV and TB. But in our case, we are advocating for women living with TB to get social grants, because they do qualify for a grant while on TB medication. But what we are finding is that many people who need this grant do not get it. And this compounds the negative impact it has on women's lives who are living with HIV, who then become co-infected with TB. Today in Mpumalanga, we having policies in action where we're going to take the Deputy President, the Minister of Health, the Premier of Mpumalanga, and we want them to talk directly with women who are living with TB, who have become disabled because of TB meningitis. TB meningitis is a TB of the spine, and it's not easy to pick up when you go and screen, because most healthcare facilities, the first line of screening is for pulmonary TB, which is TB of the lungs. They take the sputum. So if the TB is in the spine, they will not pick it up. Sometimes it takes even a year for the healthcare facility to make a proper diagnosis and then be able to provide appropriate treatment. So we feel that a delay in the provision of healthcare services and the lack of information in communities to receive knowledge about all the kinds of TBs and all the treatment is a barrier to human rights, because it's a barrier to accessing healthcare services. We are pleading that the Deputy President, in the theme of today, which is the clock is ticking, fast, treat, and end human rights, we are saying in this theme, ground it in human rights as it is promised to us in the National Strategic Plan for treating TB, HIV, and malaria. That's the plan for the country, the NSP. Goal 5 says all HIV programs, all TB programs, all STI programs must be grounded in human rights. And we are saying women are being left behind. We are not getting the support that we need when we are struggling with TB. And the other major issue, which is a human rights barrier to services and to our dignity, which is enshrined in the Constitution, is TB stigma. In 2014, there was a first national HIV index, which was supposed to measure HIV stigma. In that research, we further discovered that actually TB stigma is higher than HIV stigma. Now, in our cases, as an organization of women living with HIV who then become co-infected with TB, we are facing a double burden of stigma with HIV, stigma with TB. And in the same survey, we found that about 5% of people actually did not seek healthcare, did not go to healthcare facilities to seek treatment due to stigma. So that's a clear barrier to a human right about accessing treatment. And we also found in the same study that 11% people had feelings of suicidal thoughts, which is linked to a lack of enjoyment of the right to dignity for people living with HIV, compounded when a person who is living with HIV is also living with TB. So we are asking the country to please follow us and be with us today in Mpumalanga. We are having policy in action because we don't want only policies in writing, but we want to see policy in action. So as Positive Women's Network, we are holding 2 dialogues, one with the PL-HIV sector, which is people living with HIV sector, the other with the women's sector. And the focus there is to share our experience of how TB as women living with HIV is affecting the body of a woman living with HIV, and testimonies will be shared on the day, and we are hoping that the Deputy President will listen to us. We know that he's aware of this issue. In 2019, he had met one of the women in Northwest. Her name is Hani Stevenson. She's living with HIV and TB, and she has struggled with TB, and she became disabled, and she has been unable to work for almost a year and unable to work for almost 3 years. And she's got children and hasn't been able to work for her children when previously she was able to work. She asked me today to remind the Deputy President to say he had committed to supporting women like her as TB ambassadors of the country, to be funded, to be able to go to communities and provide psychosocial support in safe spaces of women living with HIV, and those are our support groups. We want the Deputy President, we want the Minister to bring back Splash for Hope, fund support groups of women living with HIV, fund our safe spaces so that we can support each other and ensure that we link to care and we are retained in care.
According to the United Nations Development Programme, TB kills more women globally than any other single infectious disease. As an organization that represents women, what support do you offer especially to women?
The support that we offer to is largely psychosocial support, adding one stigma linked to women not being linked to healthcare facilities. So we healthcare facilities, we find women in the communities, and we do accompaniment to healthcare facilities to ensure that they get their treatment. And once they get their treatment, we convene in a support group and run literacy programs that ensure that they have information to manage better and also understand the side effects so that women who are living with TB and HIV do not default. And then in addition, we are funded by the American government through COP20 in a partnership with other organizations like the Treatment Action Campaign, NAPWA, Sanarella, and PAC, where in that partnership we've got a memorandum of understanding with the Department of Health, where we are able to go to healthcare facilities and do monitoring, community-driven monitoring inside the healthcare facilities to monitor the provision of HIV services, which include TB. And then whatever we find as human rights violations, we then have to take up as campaigns. And if we find a woman in the facility in real time, we are able to provide the support. But we are saying this is not enough. As organizations of women living with HIV, we are not receiving direct funding to do our work for women. We are pleading with the government, we are pleading with the development partners to support us and fund us because we are marginalized as women. Women in South Africa account for more than 4 million numbers in terms of people living with HIV, and we are just over 7 million. So you can see that the burden of HIV sits with women.
Apologize for that, and thank you so much, Sindi Shangase. She's the Executive Director at Positive Women's Network on this day when we are marking World TB Day.